Hi, my name is Lisa D'Amelio, and I'm the speech and language pathologist that will be evaluating and working with your son.
Nice to meet you, Lisa. I'm Mary Smith.
Nice to meet you also. First and foremost, I want to thank you for submitting Michael's full developmental growth for me to review prior to our meeting today. It was very helpful.
Okay, great.
So today, the primary goal is to gather more information about Michael's past and current developmental history.
Okay.
And also, I read in the case history that you had concerns about determining a proper educational placement for him.
Yes, that's exactly right.
Okay. Okay, so this session should probably only take about 30 minutes or so.
Okay.
Is that okay with you?
Yeah, that's perfect.
Okay, great. Let's get started. Can you give me a little background of when you noticed something was different about Michael?
Okay, let's see. Well, when Michael was born, he was always colicky, and he had a lot of issues. We had issues finding the right formula for him. But after 3 months, it seemed to have kind of gone away.
What do you mean when you say gone away?
Just like the crying all the time. That's what really stopped.
Oh, okay. Describe when you first noticed something was different with Michael.
Well, he wasn't really reaching his milestones. I have another son, and I knew what to expect in terms of developmental milestones, and he just wasn't, he didn't sit up till he was 10 months. He didn't crawl till he was a year old. All he did was tantrum all the time, and I had no idea what was wrong. He wasn't a cuddly baby either, like where I could rock him. He just always wanted to be put down.
Oh, okay. How did Michael communicate to you his wants and needs during these early stages?
To be honest with you, he really didn't. It was really frustrating. It was kind of a guessing game. I literally had to put him on a schedule, and I said to myself, okay, breakfast time's at 8, snack at 10, and lunch at 12, and a snack at 2. I'd always keep a sippy cup of water next to him when I was trying to, when I'd see him struggle to pick it up, and I knew, he's probably thirsty, and I'd help him out. I kept telling my pediatrician that there was something wrong, but he just was always saying, boys develop a lot slower. But I wasn't accepting this answer, so I went to see a neurologist at Tampa, and he referred me to an early intervention program, actually.
I understand. From the information that you provided, it stated that you enrolled him in a private early intervention. Can you tell me how that worked out?
Well, actually, first, I actually enrolled him in just one with the state. It was really hard at first because there was a lot of children with, more obvious disabilities, kids in wheelchairs, kids wearing helmets. And I just didn't think it was the right placement for him. My son would just sit there and cry the whole time. It was free, but I just didn't think it was working out. So that's when I enrolled him in the private early intervention. And that, honestly, I can't praise them enough. It was really beneficial to him.
Can you explain a little bit more about that?
Yeah. In the beginning, all Michael did was cry throughout the entire therapy sessions. And to be honest with you, I just couldn't take it. But the therapist assured me it would get better and the tantruming would lessen. And then, after a few sessions, Michael began pointing to his needs rather than crying, which was really good. He also started, playing with toys more appropriately. Before, he would just, spin them, watch them, and then he was starting to act a little bit more normally. So that was really good.
Wow, that's great. Can you elaborate on his development or current status?
Well, I think Michael continues to progress. However, it's just, like I said, we're really confused as to where to put him, education-wise for the upcoming year. Our school district wants to put him in a self-contained classroom with kids, again, with more obvious disabilities, but I just don't think it's the right fit for him. I want him, to be somewhere where he has a proper role model for him to look up to. So that's really my concern.
I see. Okay, let's discuss his medical background information.
Okay.
Were there any difficult medical issues while being pregnant or giving birth?
No, the pregnancy was normal. It was just really hard for him to keep formula down. So we went through a lot of, trials trying to find the right one, which we eventually did. But that was all really.
Okay, I see. In your case history, it states that Michael had his tonsils out. Why at such an early age?
The doctor stated that his tonsils were abnormally large, which was giving him problems breathing. Like he couldn't breathe through his nose and only through his mouth. And he was always congested and always having ear infections. But actually, once we had them out, it really helped.
Oh, good. Does Michael have any siblings, and do they play together?
Yeah, he has a brother Joey who's older than him, but unfortunately, they don't really have a relationship at all.
In what way do you mean by that?
Well, Joey, he thinks I'm giving Michael more attention, and Michael's acting this certain way to get more attention, but I took him to a psychologist actually to try to get, to explain that Michael has autism and this is what's going on, but, still having problems, so.
I see. Okay, what additional information can you provide me about Michael that would be helpful for me to know?
Let's see. Well, he really loves airplanes. At the early intervention program, they used to, use airplanes as a reward system to kind of help him, feel happy when he's communicating well. So that was good.
Great. Well, that is something that I'll definitely keep in mind.
Okay.
Reward systems are excellent behavioral modification strategy to use for incentives to get children to do
Exactly.
things.
That's exactly what they told me, and it really worked. So that was good.
Great. Okay. Well, I really appreciate you spending time with me to give me accurate and updated information. What I heard you saying is that you really would like assistance in determining his next step for an appropriate educational setting.
Right.
Okay. Okay, so the next step that I will take is arrange a meeting with Michael.
Okay.
And we can do that next week if you're
that'll work.
available
Yeah.
or anything like that. That sounds good.
Yeah, that sounds great.
Okay, well let's go up to the front to the receptionist and see what my availability, and we'll fit you into our calendar.
Okay, perfect. Thank you so much.
Great, thank you. It was
It was
nice
nice meeting you too.
Thank you.